Welcome again. In this video, in continuation of instruments used in surgery, this is the fifth video regarding the instruments, and we are going to cover in this video the various sharps instrument having a sharp border, usually used for cutting purpose, and either for cutting or sometimes for stitching, and some other instruments come the instruments coming under miscellaneous groups. So the fifth part, just going through this classification algorithm, and in this we are going to discuss the sharps, this one, and this sharps under general surgery instruments will include the needles, the blades, surgical blades, and trocars, basically a few glimpses of trocars. We'll later on cover this trocar part in minimal access surgery instruments, but for the time being you just go through these instruments, how this trocar looks like, and details we can discuss it later on during the minimal access surgery part. So first of all, sharps. In under sharps, the first component is needles. The various surgical needles used with the suture material. One of the important information, what is the sharpest object ever made till date, and that is tungsten needle. It tapers down to the thickness of a single atom. And how we can do that? We can manufacture these uh, types of needles by placing a narrow tungsten wire in an atmosphere of nitrogen and exposing it to a strong electric field in a device, and that device is known as field ion microscope. So question could be in the MCQ part, the competitive exam, it could be like, what is the device that is used, that is called, to make a tungsten needle that tapers down to the thickness of a single atom? And that is, the answer is field ion microscope. Okay, and this is how a needle looks like, and this is basically the part that is going inside the tissue first, and this is known as needle point, and this curve or this part is known as needle body, and this is the swaged end where the thread is attached, this one, right? And this is the basic structure of a needle. The surgical needles, again, you can see this is the part of the surgical needle that is going first inside the tissue, and this is the swaged end where the thread is attached like this, right? Similar the second one, and there are important things regarding the tip. This tip of the needle, there are various types of tips. Let's see, like this. This is known as round bodied needle, right? Tip is round bodied. Okay, then curved cutting and reverse cutting. These are the types of needle geometry, the tip. Then taper cut. This is the tip in taper cut, how it looks like, and this is the body of the needle. Then micro point and the spatula type. Then blunt taper point. So these are the basic types of needle tip or needle geometry, and How this information is important to us, how can we use it? By knowing this, um, for example, for taper point needles, they are basically used for soft tissue, and these taper point needles like this, what they are going to do, they usually dilates the tissue rather than cutting it, right? Taper point. Then let's come to the reverse cutting. Reverse cutting is just almost opposite to the taper point. How come? Because it is cutting rather than dilating the tissue. So it is ideal for skin, a tougher structure. And this is very sharp, right? Reverse cutting. So almost opposite to each other, this taper point and reverse cutting. Then the conventional cutting needle. Conventional cutting. It's very sharp. It cuts again, the preferentially it cuts, but it creates weakness and it allows suture to tear out sometimes in conventional needle. A slight disadvantage as compared to the reverse cutting, right? Then taper cutting. Taper cutting is basically ideal in tough or calcified tissues, and so it is mainly used in cases of cardiac surgeries and various vascular procedures where calcified tissues are commonly seen. Okay, taper cutting. So taper point, reverse cutting, almost opposite to each other regarding the dilatation and cutting of the tissues. Then conventional cutting, it creates weakness, so suture usually tear out from the tissues, and taper cutting for vascular surgery, cardiac surgery. Apart from the tip, another important thing is the needles, the shapes of the needle. Suppose there is a circle and we are going to divide the circle into four quadrants like this: 1, 2, 3, 4. So if the needle is starting from this place and it is going from covering this 1/4 of the circle, then again going towards another 1/4, and so combining it, it is becoming half circle. So this type of needle is known as half circle needle regarding the shape. Similarly, here you can see one of the quadrant, we are dividing it like this into two, again two, similarly two, and to total 8 parts. We have divided the circle into 8 equal parts. Now see, this shape is covering one part, then second part, and then third part, right? So that's why this is known as 3 by 8 circle shape. Okay, all these needles have very commonly this 5 by 8 circle. Similarly, you can see here 1, 2, then 3, 4, and then 5. So this type of 5 by 8 circle. Similarly, 1 by 4 circle. 1, 2, 3, 4. Earlier it is 2 by 8, but simplifying it, 2 by 8 is equal to 1 by 4. So this is known as 1 by 4 circle. Similarly, the J-shaped needle, the compound curve, the half curved, and straight needle. So these are the various shapes of the needle, and these needles are depending on the region or the site where it is supposed to be used, we choose the needle shape. For example, 5 by 8 circle, urology, and the pelvic surgeries, right? And this J shape or half curved circle and then shape needles, they're commonly used in cases of minimal access surgery also. All right. Then common uses of atraumatic needles, the taper point. If you can remember these things, very good. Otherwise, you can choose the important thing like soft tissue closure below the skin surfaces, taper point. Durameter, the neurosurgery. Fascia, the GI. The muscle, the nerve, the pleura, the vessels, the soft structures are being taken care of by using taper point, right? The blunt point is used basically for friable tissues or solid organ, the visceral abdominal organs like spleen, the liver, the kidneys, the cervix. The blunt point needle, atraumatic needle is used, right? Then cutting edge for ligaments, the tendons, the calcified or fibrous tissue, the thoracic, plastic, obscini and scar tissue. Similarly, the reverse cutting means more cut. So it is used for skin closure. Sometimes we can use it for the tension suture, the ligaments, the fibrous tissue, or sometimes mucosa also. The taper cut is used for bronchus, the calcified tissues, the nasal and oral cavity, the periosteum, the trachea, uterus, and vessels. And the spatulated curved needles, they are basically for ophthalmic surgery, right? For retinal repair, eyelid suturing, and all these things, right? If you are going to repeat all these things many times, it will be easily remembered by you. So don't take a stress regarding this table. Whatever you can remember, that is enough for you. Then after covering the needles, the next comes the surgical blades. Surgical blades, there's a blade series there, and we can divide it in broadly into two groups. The number 15 blade and number less than number 15, and all these numbers, they can be used with the Bart Parker handle type number 3, then the number 20 and more. Well, any number that is more than 20 and 20, these type of surgical blades, they can be used with the BP handle number 4, right? And then after that, the surgical blades, here you can see, here this one is 11 number, this one is 15 number, right? So these are basically used with number 3 Bart Parker handle, BP handle. And here the number 20, 22 and 23, these are the commonest one we are using during the general surgery procedures. This is basically used with the BP handle, Bart Parker handle number 4. Okay, so these are surgical blades. And here you can see surgical blade number 11, usually used to stab the site, used with BP handle number 3. Then surgical blades number 15, used with handle number 3 again. Then surgical blade number 22, it is usually used for with BP handle number 4. Then a very interesting comparison between obsidian versus steel surgical blades. You will be surprised to know that this obsidian, it can fracture down. We can fracture down this obsidian down to a single atom, and that's why it is claimed to have a cutting edge 500 times sharper than the sharpest steel blade. Very interesting point. 500 times sharper than the sharpest steel blade, this obsidian. And even under high magnification microscope, an obsidian blade still appears smooth, whereas a steel blade has a saw-like edge, right? So obsidian versus steel, obviously the obsidian is more sharp as compared to the steel blade. Then finally this in the shafts, the trocars. Just to give you an idea, the look, this is how the trocar looks like. Here you can see this pointed portion, and this is going inside this outer sheath. This is known as cannula, and this trocar is coming up to this place, and this portion is a part of this trocar. So trocar is usually used with cannula sheath, right? And this is the trocars use basically disposable type and non-disposable or reusable type. So this is how a disposable type of trocars you can see. Basically this one is, the various sizes are there, right? Between 5 mm to 12 mm. The disposable trocars. Disposal means one time you are using it and then again you will have to discard it. And this is a variety that is reusable type. Every time after the surgery you can just sterilize it, and it can be reused. Right? This is a 10 millimeter, 10 mm trocar. So that is all in case of sharps. So we have covered the sharps, and the next is the others. In others, the containing the various probes, the blade handles, the Bart Parker handle. This one, like this is an anal probe. This probe is basically used to manage the perianal fistulas. So just try to understand the details we can discuss later on. So anal probe. This is BP handle at the tip. Two varieties are available: the Bart Parker handle number 3 and number 4. I have already told you from 11 number surgical blade up to 15 commonly used with number 3, and for number 4 from 20 to 30 surgical blades are available. This is used with surgical blades for cutting purpose, and it is grasped like a pen, and it is always transferred in a kidney dish. But remember, whenever you are giving a laparotomy incision, it's always better to hold this BP handle horizontal or horizontal fashion or parallel to the abdominal wall for getting a clean incision, right? And finally, the skin grafting knife. This is a skin grafting knife. There are various types of skin grafting knife. This is the usual one through which in this place we are inserting the blades that is going to cut the skin graft. This is the handle. We can hold this instrument from this place, and from this and this place we can adjust the thickness of the graft. And all the work of the skin grafting knife, this revered in 1869, the first skin graft was performed in Denmark. After following this Reverdin work in 1869, in Denmark the first skin graft was performed in 1870. Okay, almost 150 years back, the first skin graft that was performed, and this is known as Humby skin grafting knife, the Watson. These are the various types, various varieties, variations of skin grafting knife. The various variations what already has been done. And for Jesse, the breathweight skin grafting knife. Okay. There are three basic instruments in general for removing a graft of a split thickness skin from any donor site. We can use the knife, we can use the drum type dermatome, or we can use the electrical dermatome. So knives, these are more popular in Britain, like this one, and dermatomes, these are more popular in North America. What is the principle of action for these skin grafting knife? There is a sharp blade moving back and forth to cut a piece of skin whose thickness is controlled by a calibrated setting on the instrument or by the surgeon itself. So various thickness skin graft, we can take it out for the use by using various skin grafting knife. Just to give you an information that before pedicle flaps were employed in reconstructing noses, the the Indians we were utilizing the free grafts of skin, including the subcutaneous fat taken from the gluteal region after it had been beaten with wooden slippers known as kadao until a considerable amount of swelling had taken place, and we were taking the free grafts of skin from that place, and we were using a secret cement for the additions at that time, and which was ascribed with a special healing power, and this was our ancient Indian method of grafting, right? And this is the earliest record of free whole thickness grafting, and that is available today. Okay, so that is all in this section. See you in the next part. Thank you.